this is Nick. Nick is my current medical student, so I'm going to show him some manipulations. He's kind of been watching me for the last few weeks, and I promised him I'd let him experience some manipulations. So you see how I start with everybody up here. This is where the first rib is. Does that feel a little bit painful to you compared to this side?
It does.
Feels like you have an elevated first rib. It's easier to feel when someone's laying down, so we'll check that. So here's your spinous process, and I'm going right here. This is where the transverse process is. So you see me kind of walking down someone's back like this. You definitely have some issues up here. And you were telling me before your back bugs you. Where's your back bother you?
Usually it's the lower back.
You have a lot of curve in your back. Just kind of seeing how you stand. Okay. Bend forward for me. Okay. And we can see here, Michaela, come in a little bit. Can you see what I'm seeing on his back here? So my thumb is a lot higher on this side, so you have a hip issue right here. So I'm gonna have you start on your back. Lay down. And so before, what I tell Nick is I always look at hips and sacrum because that can be causing a lot of back pain for people. Not necessarily everyone, but I always check those things out. I'm gonna look at his first rib first, and then we'll move to your hips. So when you were standing, it was definitely on this side.
Mm-hmm.
Does that hurt?
It does.
Okay, so bring me your arm, and you've seen me do this a couple times, so it's easier to feel on you. So you feel where it kind of got harder under my thumb there. Like, did that feel like it got a little bit more painful right here?
Yes.
So that's my stopping point. So you're gonna take your arm and you're gonna pull it this way for me, and I'm gonna push down. Go ahead, and relax, and then go ahead and do that again, and relax, and then one more time. Good. And then we're gonna recheck that. So is that still hurting when I'm pushing in there?
It does.
Does it feel better, or does it still hurt right here? Like, so when I pushed in here before, like it was more painful on this side than this side.
Mm-hmm.
Does it feel that same pain, or does that feel better?
Right now, no pain.
Okay, well then we fixed it. Perfect. So then we're gonna come and look at the hips. So we come to your ASIS, and you see me do this on all the patients when I'm checking hips. This side, you remember me showing you how this is how I'm looking at this? Yours is tilted back, and so this hip is up compared to your other side. So we're gonna take this, and we're gonna drop your leg off the table here. I'm gonna push your knee down, and then I'm gonna push down on this ASIS, and you're gonna push your leg up for me. And relax, and then push up again. And relax, and then push up one more time. Now, Nick is doing something very, very smart. Most men don't do this. He has his phone in his front pocket as opposed to being in his back pocket. A lot of guys put it in their back pocket, and when you sit for a lot, it kind of puts your hips off kilter. He doesn't have that problem. That's good. That's better. Okay. So we're gonna check. So you saw a lot of me like essentially digging into people's hips.
Mm-hmm.
So I'm gonna kind of show you kind of what that feels like. So you find again the ASIS, and just like right on the inside, that's where the iliacus is.
Mm-hmm.
If anybody saw Nick's face on that video, it was not happy. This does not feel good, but it makes a huge difference when it comes to hip pain and back pain. So I always bring a patient's leg up like this because it takes a little pressure off. It makes it feel a little bit better. So that shouldn't be as painful as it was, but it still hurts. Now you know why everybody is jumping and screaming at me when I do this. But it does make a lot of difference, and Nick spends a lot of his time studying, so I kind of just know that he probably has some tight hip flexors. Biggest thing for people when they have tight hip flexors is they'll tell me that they feel like a clicking, popping sensation in their hips. It's not generally their hips, it's more than likely it's going to be the hip flexor muscles or the common flexor tendon. Right there, you felt that kind of like roll over, tightness, yeah, right in there. You doing okay? Good. And you should feel as I'm continuing to do this that it's starting to hurt a little bit less than when I initially started doing it, which is a good thing. That means things are starting to loosen up. Good. That's better. Okay, now flip over onto your stomach for me. So there's a little face hole right here. So you can put your face right in there and then just drop your arms, whichever one's comfortable. Yeah, like that. So when I am doing, you saw me do a lot of myofascial release. And so I'm kind of seeing, and your back really isn't super tight down here. So maybe it was your hips that were bothering you. Because this really is not very tight. Let's go here. You're very poppy. So he definitely has this band of muscle tightness here. a rib that's out right there. Okay, so we're gonna fix this rib. So I pull your arm up until I feel it like get harder under my thumb here. You're gonna pull down, and I'm pushing down and lateral, relax. Come up to the next spot, down and lateral. Again, push down, good. And then one more. Good. That's better. Okay, stand up and see how that feels. Bend forward and see how that feels. See if it feels any different. Because you didn't have too much pain when you came in, but you had a little bit.
Yeah, usually if it's like if I stand a lot.
Okay.
Standing all day. I get back.
How does it feel compared to when we started it?
Feels better.
And it's different for everyone. Like some people it takes a couple days to feel better, so we kind of just play by ear and see. You